All right, good afternoon, everyone. Thanks for joining us today. Still waiting for some people to trickle in, but wanted to go ahead and introduce myself and get us started. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY Campaign. And after February's ice storms and last month's flooding, it is so nice to be joining you all today on a beautiful spring day. I hope it's beautiful wherever you are in Kentucky. I know a lot of us have also gotten our first or our second dose of the vaccine since our last webinar, and that has made this Easter feel very different from the last in the best way. So that's making a lot of us feel very hopeful for some things to come this year. Now, will say I feel like a broken record when I say that a lot has happened since our last call, but it keeps being true. March brought us a lot of new legislation, some amazing, some pretty terrible. So today we're going to tell you about everything that happened in terms of our safety net during the General Assembly that is thankfully behind us now. And we're also going to tell you all about the American Rescue Plan and how it's helping Kentuckians recover. So as always, our goal with these briefings is to make sure that you get the latest information on the state and federal response to COVID-19, updates on our safety net programs, and learn about opportunities to educate and advocate. We'll be sure to tell you what's happened in the past month and also what we're anticipating for the future. And many of you should be familiar with our ThriveKY campaign by now. Could you advance the slide, Kelly? I forgot that I wasn't the one controlling them. Thanks. For those of you who are just joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And you can see our shared principles on this slide. If we go to the next slide, you'll see the members of our campaign. And then let's go ahead to the next slide. I also want to give a quick shout out to our new ThriveKY sponsors and thank them for supporting our webinar series. Having this support helps us to bring these webinars to you for free and to offer free CEUs to CHWs and to social workers. So we really appreciate this support. And we're excited to be continuing to provide these monthly webinars throughout the rest of 2021. Let's go to the next slide. Here's our agenda for today. Each of our ThriveKY partners are going to be covering their area of expertise. And before we begin, just some quick housekeeping. We do have a lot of folks on the webinar today, so please be sure to mute your line. We'll also be recording this webinar. We'll send out the recording and any other follow-up materials in an email probably tomorrow. And as speakers are presenting, you can use the chat box if you have questions or if you have comments. We try to cover those as we go as much as we can. We find that that works best. So don't be afraid to just chime in whenever you have a question or a comment. And finally, if you are a certified community health worker or a licensed social worker, if you want to receive credit for today's webinar, please email me or Kelly, and we'll have contact information at the end. And with that, I'm going to turn it over to Dr. Sheila Schuster to give us a recap of the 2021 General Assembly.
Thank you very much, Emily. I'm Sheila Schuster, a licensed psychologist and executive director of Advocacy Action Network, and I've been going to Frankfurt since 1978. This was supposed to be a short, non-controversial session, and it was short, 30 days, but it felt like it went on forever, and it was certainly not free of controversy. At our March webinar, we talked about the first part of the session where 9 bills were passed by the legislature and the governor vetoed 7 of them. All of those were overridden, but 2 of the bills were appealed to Franklin Circuit Court for injunctive relief, and we're still waiting for a ruling from Judge Shepard in that case. They had to do with rolling back the governor's pandemic emergency orders and emergency regulations. We also talked about the fact that this was an unusual session, a short session, because they had to do a 1-year budget. That's for fiscal year 2021-22 or fiscal year 22. And the original talk was that that would be done in the first part of the session. It was not done until the closing days, actually, of the session. And when it went to the governor, he vetoed, and this is one of the few bills where he can veto just certain passages or items in the bill. He vetoed 20 items, and all but 2 of those were overridden then by the legislature when they came back on March 29th and 30th. But the good news is that a behind the scenes agreement was reached between the governor and the legislative leaders to allocate a sizable portion of the American Recovery Plan Act. And Kara's going to tell you more about that. But we were concerned that the governor's hands were going to be tied and that those funds were going to sit there until we had either a special session or until next January. And those funds are really supposed to be out addressing the aftermath of COVID. The budget was not as good, we thought, as the one that the governor had proposed. He had proposed bonuses for teachers, pay raises of 1% for state employees who have not had a pay raise in many, many years. No cuts for Medicaid or education. He also had authorized waiver slots for Kentuckians who have significant disabilities and want to live in the community and not in an institution. The final budget that was passed also did not have any cuts, but it failed to fund textbooks for our schools and other things that we really needed. The quasi-governmental agencies did receive the necessary funding to meet their employer contributions. That was very important to the community mental health centers that provide services for people with mental illness, substance use disorders, and developmental and intellectual disabilities. Next slide, please, Kelly. So we had a lot of new legislators and a lot of people were very active in proposing bills. So 900 bills is a high number for a 30-day session. And I've laid out for you various bills that were signed by the governor, 134 that have been signed in the first veto period. Some were overridden and became law or will become law despite his veto. Some parts of the vetoes were overridden and the rest will become law. Unless the bill has an emergency clause, they will not become law until late June. I think it's June 27th. It's 90 days after the session adjourns. So then the legislature came back into session on March 29th and 30th. And these are the late days if you're an advocate in Frankfurt or watching the session where you're staying up till midnight, literally, on both of those days as they finished. And they passed another 38 bills and resolutions, which went over to the governor. If they are vetoed, if any of those are vetoed, or if any of those have line item vetoes, the legislature will not have any opportunity to override those vetoes. And that period lasts until April 10th. So we really won't know the sum total of the legislative session until we get to April 10th. So the next slide, please, Kelly. So I've divided this, and this is the Schuster determination of what's positive and what's negative. So some people may disagree, but here are some of the things that most of the folks in the Thrive community were supporting. House Bill 50, which establishes mental health and substance use disorder parity, which is the equality, which means that insurers and MCOs cannot treat behavioral health issues differently than they treat physical health issues. And this is a long-standing problem. We passed legislation in 2000 originally in Kentucky to address this problem. This actually gives the Kentucky Department of Insurance the kind of policing power to make sure that parity is being met. Each of the insurers and MCOs will have to submit in writing to the Department of Insurance each year how they are meeting the federal parity standards. So we're very excited about this. This will increase access to behavioral health services. Another super important bill for both behavioral health and physical health was House Bill 140, which made permanent some of the relaxation of rules that the Center for Medicaid Services approved during the pandemic. So it says that providers should be reimbursed on the same basis as if they were providing the service face-to-face. Many of you that are on this webinar may know of someone who is accessing either behavioral health or physical health services, or you may have done it yourself through telehealth. It addresses lack of transportation so often that our Kentuckians have in getting to appointments. I know that both for behavioral health and physical health, the no-shows or the canceled appointments were down significantly, and more people had access. It also points out the lack of broadband and the lack of accessibility to reliable internet, which is hopefully going to be addressed with some of the federal funding. Senate Bill 55 is an issue that many of us have worked on for years and years, and it eliminates Medicaid copays altogether. There was a statute on the books that said that the Department for Medicaid Services had to have at least a nominal copay. Well, those nominal or small copays can really add up. So if you're paying $3 for every prescription and you're on 8 or 9 medications, that's a sizable chunk each month. So we're delighted to see that this has gone into effect. I will also remind you all that during the pandemic, if you are on Medicaid or if you know of anyone who's on Medicaid, all of the copays have been suspended during the pandemic emergency order. House Bill 95 is also a bill that's been around for a couple of sessions. This is Representative Danny Bentley, who has diabetes himself, and Representative Patty Minter, whose son has diabetes. And this puts a $30 cap on a 30-day supply of insulin. This is a huge help for the many, many Kentuckians who suffer with diabetes. In the similar vein, Senate Bill 45 will help with the cost of really expensive medications. So if you have a super expensive medication and you get some assistance directly from the pharmaceutical company or through some other help with the cost of that medication, the help that you get will help you meet your deductible and out-of-pocket expenses on your insurance. So again, it kind of gives you credit for the help that you received as a payment for that expensive medication. Senate Bill 4 put some restrictions on no-knock warrants. It's not the, did not go as far as Breonna's law would have gone. That was the House bill that Representative Attica Scott had filed even before the session began. But this does put some restrictions and requires law enforcement to use body cameras and so forth, limits the hours during the night when a no-knock warrant can be issued, and also limits the kinds of offenses that are thought to be the cause of the warrant. House Bill 497 is a bill that came late in the session. In fact, came in those final 2 days of the session, but has already been signed by the governor. And this creates a number of aids to individuals who are reentering society from incarceration. So this makes them eligible for Medicaid even 30 days before they're released from jail or prison, gives them access to a photo ID, gives them access to an employability certificate, and those kinds of things that we know are so critical to people getting back on their feet in the community. House Bill 212 was Representative Samantha Heverin, and this begins to address some of the racial inequities and disparities in our healthcare system. It would begin with gathering demographic data on child and maternal mortality, but we're hoping that it will be expanded to all kinds of health data. The governor's done an excellent job of pointing out the unfortunate lack of equity and access to services as we see the disproportionate impact of COVID on our Black and brown fellow Kentuckians. House Bill 382 was a last minute kind of compromise between the governor and the General Assembly, and it provides funding for full day kindergarten, which has not been the case in many Kentucky districts. Some of them have no public school kindergarten, some of them have a half day. And we know that the earlier youngsters get that full exposure to educational and social interaction, the better off they are. So this was a really important infusion of money. And it also established other funding for the American Recovery Act, Recovery Plan Act, federal allocations. On the spending side, unfortunately, House Bill 563 was passed over the governor's veto, and it takes money out of public education and would make it available for private schools and private school tuitions. Senate Bill 65 penalizes parents who are late with support payments, child support payments, and taking away SNAP benefits. The argument for those in favor of it was that it would take it away from the adult, but we know that those adults are in homes with children and everybody eats that food. So we're really concerned about the negative impact on the entire family. Senate Bill 8 was a bill of great controversy. There were a number of organizations who were very concerned about it. It was somewhat improved during the legislative process. It started out as a broad prohibition on vaccinations, period, and would have actually removed the requirement for school children to get vaccinated before they entered school or daycare situations. It was narrowed somewhat, but it still creates another exemption for a conscientious objection for people who don't want their children to be vaccinated. And we think that's a public health issue that's going to be problematic. House Joint Resolution 77 would end the pandemic executive orders, also restricts the Cabinet for Health and Family Services to giving any direction to public health departments during a pandemic. It again was passed as an override of the governor's veto. House Bill 258 creates an entirely different retirement benefit for new teachers. They would no longer be in the state retirement system, but would be in a self-funded 401B or that kind of retirement. The argument against it that was voiced by many was that it will make teaching less attractive to qualified people and make it less attractive for people to stay in Kentucky to be a teacher here. And the final bill is one that would give the legislators the final say on open records requests for certain legislative records, which doesn't sound like much of a problem, but if you think about the lack of access of the public to those records, it really does put a dark pall over that kind of openness that we would like to see all of us have to the records that should be public. Next slide, I think it's the last one, Kelly. So this is my kind of 25,000 feet. We have been concerned from the outset. We were concerned before the session went into effect. Many of you signed on to a letter that we sent to leadership in both the House and the Senate way before the session opened, saying how's the voice of the people going to be heard? What's the access going to be? What's the ability to testify in committee and so forth? And I think somewhat grudgingly, those directions were kind of given out in little bits and pieces. We kept having to update that access document. We know that the annex and Capitol buildings were essentially closed. And you really saw it late in the session with the teacher retirement changes and with the House Bill 563. In previous years, we would have seen hundreds of teachers and school personnel crowding into the annex and the Capitol and raising a ruckus, quite frankly, about their concerns. They were reduced to a drive around of the Capitol and the Capitol Annex on March 29th, honking their horns and holding up signs saying, don't do this, don't do this. A very different kind of atmosphere. Changes in the House and Senate rules made it much more difficult for us to know whether a bill was going to ever get heard in committee or not. And unfortunately, the vast majority of bills that were sponsored by Democrats were never assigned to a committee for a hearing. There were also Republican-sponsored bills that were not assigned to a committee. But if you look at percentage-wise, and I haven't gone back and done this, but I know that there are vast numbers of bills sponsored by a Democrat that were never even given a chance for a hearing. And then in the closing days, March 29th and 30th, where they were coming back to examine every one of the governor's vetoes and vote on every single one of them independently, they restricted all debate to 5 minutes for each side. And of course, the majority side was not going to debate because they were all in favor mostly of overriding the vetoes, but it really shut down the ability of the minority caucus in both the House and in the House from having any meaningful debate and discussion. So I think it's unfortunate. I think it's not the way that our founding fathers and mothers thought that democracy should be played out. And I'm hoping that we'll be able to have full access in 2022. So I will close at this point and hand it over to Kara, who's going to talk to you about the federal relief. Kara?
Hi. Yeah. So, a lot of these we talk about what might happen, and now we can talk about what has happened. Go to the next one, Kelly. So there's a lot of money flowing into Kentucky, which is great. But the big takeaway for today is that there's still more of it that needs to be appropriated. So like Dr. Schuster mentioned, the General Assembly allocated around $1 billion in one day, sort of the end of this session, but there's still more that needs to be determined on how it's going to be spent. The governor had in his proposal to send direct payments to Kentuckians with incomes below $25,000 or $50,000 for a couple, and that didn't happen in the legislature, but we'll wait to see what the governor is going to do with that. But you can see some of these numbers, they're a really big deal. And what we know right now is what's going to be going to cities and counties. The division is that it's going to go evenly, except for Jefferson, who's getting a deduction to balance out other sources that they've got coming in. And these numbers are mostly just for reference when you get this in your email. Go to the next one, Kelly. I thought of course, this is from the Kentucky Center for Economic Policy, KY Policy, about what happened in that day, or 2 days, to send the money around. And we are, the big ticket item is we paid off our unemployment. I'm sure everybody's heard about the issues with unemployment, but we have paid that off with money from the American Rescue Plan Act. That's going to be a challenge of this, is who is, how to pronounce that every time, ARPA. And I saw a question on who's dispersing housing. Adrian's going to talk about the housing specifically later. There's actually a lot of questions about who's going to do what and how with this money. That's sort of where we still are. And so that's where advocacy is still important, is to make your voice heard about how you think it needs to be spent or where you know it needs to be spent. I'm excited personally about this infrastructure pieces with the water and sewer and broadband, especially, we already had the 250 earlier in the session million for broadband, but this bumped up a little bit more, and there's definitely a focus on the last mile, which has been an issue. We can go on forward, Kelly. So, and of course, what's the thing that everybody really for sure knows about in the American Rescue Plan Act? It's the checks. It's the relief checks. So the relief checks that have been sent out, most people have gotten it, but if you haven't, don't panic. It's still coming. They send it out every week. So every week there's another batch that goes out 3 different ways. Some come in paper checks, some go direct deposit, and some go onto cards. And I read the IRS's website till I was blue in the face trying to get an explanation as to why, when they've got somebody's bank account, they still send them a paper check. And they said it was faster, but no explanation as to why. Just so you know, don't spend your time digging through that. When you get this in your email, that IRS Get My Payment is a link so that you can double check to see if you haven't gotten yours, and talk to the people you're interacting with to make sure, because a lot of Kentuckians who don't necessarily normally file taxes should and need to now to make sure that they get the relief that they're entitled to. Go to the next slide. What else is happening in DC? This is always our sort of check-in point. Go ahead to the next one. This is what's happened. We know all of the laws that have passed. The only 2 things, there's an infrastructure bill that has been introduced that exists right now, and President Biden has said that there will be an immigration that is also in his sort of focus. That's the only things we have had said out loud that we know are happening, but it's not enough to sort of dig into yet, in my opinion, because it's been introduced. Nothing's moving yet, but that's where we are. We're at sort of a wait and see for a big infrastructure package and a big immigration package. And then into the details from before of exactly what's happening. I think the table in Kentucky is probably more important. But if you are one of those folks who have questions about unemployment, all of that was extended. So it's important to know that that's still extended and you still got extra benefits that are coming to help everybody get through while we still haven't recovered, right? Or at least a big chunk of our economy hasn't recovered. And of course, the SNAP benefit has been extended. And then, so to figure out where, if you don't feel strongly about where the money needs to go and what you need to be saying to the people about how to spend it, bet you'll get stronger feelings after listening to Dustin from the Kentucky Center for Economic Policy.
All right, I hope so. That's the goal, at least. So I'm Dustin with the Kentucky Center for Economic Policy. I'm the senior policy analyst there, and we're going to shift gears kind of away from the big legislative picture and into some more specific programs and needs in the state. And so as usual, we are going to go through some of the economic background just to understand where we are and how we got to this place and what the outstanding needs are. So I'm going to start with this chart, which is really what 1 year of an economic and public health catastrophe looks like. We, as you can see, had an enormous, unprecedented drop in jobs. When I was initially making this graph, I was doing change month over month, and I had to get rid of that because Dr. Schuster thought that the most recent month was just the y-axis on the wrong side because the bar went that far down. We lost over 300,000 jobs in the course of 2 months. Which is really just unprecedented. And while we had a really impressive rebound initially, that has since stalled out. So we had a pretty quick turnaround during the months of May, June, and July. We made up about half the ground we lost initially. A lot of folks were laid off temporarily and were able to go back after our first round of shutdowns. The stimulus money did a really amazing job, both through unemployment insurance benefits and through the stimulus checks. But really, you know, we haven't seen much of a difference since then. Now, what is not accounted for here are basically the results of the money that was invested through the American Rescue Plan Act, which is a lot, as you've already seen. And so there's some question about, you know, how jobs will respond moving forward, especially as people start spending that money and a lot of pent-up demand is sort of released into the economy and cases are low still. But for now, we are still about 4.6% below where we were a year ago. While we've made up a lot of the jobs we lost, we're still 90,400 shy of where we were. And, you know, in a normal economy, we wouldn't just hold steady. Our employment would continue to rise as our population increases and as you know, a large contingent of younger folks enter into the workforce. So we're really actually pretty far behind where we would have been had this not happened. The other concerning trend is, of course, that temporary layoffs are coming to a halt and permanent layoffs are starting to set in. And as everybody knows, that's a much harder trend to reverse. So hopefully, again, some of the stimulus money will help, relief money will help, but we're still in a wait and see situation. So let's go to the next slide. So that's what the big picture employment situation looks like. When we break it out and look at instead jobs by income, it looks a lot different. Now, this is a different data set than the last one I showed, so the picture looks a little better in this case. These are jobs through, well, actually, they're postings that have been filled essentially through Indeed.com, which is a hiring website. If you are interested, there's an interactive version of this at what's called the Economy Tracker through Opportunity Insights. But essentially, what we know, what has been the case the whole time, is that if you work in lower wage jobs, you are still very much in a recession. If you work in higher wage jobs, then you've been recovered for some time now, and you're not really feeling the effects of the downturn as much. So while middle and high wage jobs in Kentucky have returned to pre-pandemic levels, low wage folks are still, still struggling. And this doesn't include folks who are independent contractors. These are just people who are employed. So there's a lot of folks who earn their living on their own, who are also still either without work or with a much more diminished situation. So let's move forward. The other reality is that women and people of color are still falling, or not falling behind, but have not recovered as men and white Kentuckians have. So I usually have a bar chart in here that shows Black unemployment insurance claims versus white unemployment insurance claims. And the picture hasn't changed really since the beginning of the pandemic. Both are improving, but white Kentuckians have improved better, or at least more quickly than Black Kentuckians. And again, a lot of that has to do with the types of jobs that Black Kentuckians have tended to work in through historic and structural realities that are hard baked into our economy and that we haven't made up for yet. And for women, what has been true for most of Kentucky's history, and indeed across the country, is that men tend to work in industries where they are covered by unemployment insurance more frequently than women. And when there are slowdowns, traditionally, men tend to be laid off more quickly. So, things like manufacturing, mining, construction, these are very male-heavy industries that in a normal recession, they would be the ones to slow down first. In this circumstance, it's been more hospitality and leisure, food and accommodation services, and then healthcare and social services that have been hit harder. And so Kentucky was in a really bizarre circumstance where women were overrepresented in unemployment insurance claims for the first time since 1998. And they were in that situation for 7 months during 2020, whereas, in 1998, I think it was just 2 weeks. So, that has been really problematic, especially as another industry that women are more represented in, being state and local government jobs, has actually been one of the hardest hit industries as well, and has been really slow to recover. And what that means is not only are jobs harder to find for women, it's also more difficult for them to continue to close the wage gap, which remains at about 78 cents on the dollar. Another reason why women have had to leave the workforce during the pandemic is because a lot of childcare centers and schools were closed. And while schools are reopening, our childcare center capacity is not up to where it was before. And so it really points to the need for some meaningful public investment in childcare, which was done through the American Rescue Plan Act. But that's a one-time increase that will help. We really need a permanent change to make sure that this is not as much of an issue moving forward. So let's keep going ahead. I just wanted to stop here or end here on the economic update, because I think this is a really compelling image. So if you look at this line graph here, you'll notice that initial dip. That was when everything closed down, when a lot of folks lost work, when people lost income, and before the enhanced unemployment insurance benefits kicked in. So there was a huge dip in consumer spending in Kentucky initially, and then it plateaued when unemployment insurance benefits started being distributed, and it bounced back up after stimulus checks went out the door. And then you'll notice it sort of hovered more or less around where it had been in January. And then there's another spike, and that spike is when added unemployment benefits returned and when the $600 stimulus checks came. And of course, the added unemployment benefits stayed, but the stimulus checks left. And so we saw another dip. So this ends again right before the new round of stimulus checks hit people's bank accounts. And right before folks on unemployment were guaranteed another 6 months of benefits. So it'll be telling to see where this moves from here, but at the moment we're about 9.3% below where we were in January last year. Two important things to point out: 35%, nearly over 1 in 3 Kentucky adults still report having difficulty meeting usual household expenses. And when people were polled in the household poll survey about how they use their stimulus check, the largest categories were things like food, household supplies, utilities, and car payments, as well as paying down debt that they likely accumulated during the pandemic, just trying to get by. So I say all that to say, we're not out of the woods. I know there's been a lot of talk about a really fast recovery at the end of this year, and I think that's probably likely. But in the meantime, there's a lot of very real human suffering going on that requires our attention and requires a robust safety net. And that is a reality for across the board in Kentucky, but it's even more so for women and people of color and low-wage Kentuckians. So let's go ahead and move forward. All right, so quickly, I just want to give a few updates on unemployment insurance. I'm going to start with my usual chart here. As folks can see, the light blue is what's called pandemic unemployment assistance. That's the special program for independent contractors, gig economy workers, small business owners, and recently folks who are not given proper accommodations at work for like PPP, I'm sorry, PPE, and other ways of ensuring that they don't get COVID, as well as if they have COVID and they have to stay home. And then the dark blue bar is just what we think of as regular traditional state unemployment insurance. So this has been holding pretty steady for the last several months. You know, it looks low, but it's still twice as high as it is during normal times. There's some evidence that it may be creeping up again, which is concerning. But in the meantime, we know that there are still a lot of folks who are claiming unemployment benefits. And I should also say that it's I think, a testament to the Labor Cabinet, who has had a lot of difficulty with making unemployment claims and making sure that folks are continuing to receive them, that we didn't see a huge drop off, because in December, you'll notice that PUA went down to, I think it was 5 claims during the week that they transitioned from the CARES Act PUA benefits to the December packages PUA benefits. And this time they didn't miss a beat. So I think that's an improvement. I know that there are still really significant problems with people receiving their benefits, being able to get through and talk to someone. But in the meantime, I think there's some hope that things are getting better. So we'll move on to the next slide. As Kara mentioned, the American Rescue Plan Act extended these 3 really important programs through September. The first is PUA, which I mentioned. The next is Pandemic Emergency Unemployment Compensation. That is basically additional weeks of regular state UI for folks who have exhausted the 26 weeks that they're eligible for. As you saw on the last slide, there's over 35,000 folks using that in Kentucky right now, as well as PUC, Pandemic Unemployment Compensation, which is the extra $300 per week, which is super important right now to help people stay afloat. Typically, unemployment benefits only make up a little less than half of someone's income, so in Kentucky at least. So adding the $300 on top of, I think, what's an average of around $280 for unemployment insurance benefits is really helpful. For PUA, it's even lower. It's around $175 per week. So adding the $300 on top of that, again, will make sure that people can stay afloat. I have this sort of tagline here at the bottom that I'm just going to keep, which is that we've basically been sprinting toward a cliff for 3 rounds of unemployment extensions now, and we got to stop doing that. We really need a federal fix to create an automatic response to downturns so that we can stabilize the economy and not have to continue living in uncertainty, driving employers crazy, and having to force state programs to continually update and change their systems. All right, I think I've got one more slide. Just building off of some of what Dr. Schuster presented, I wanted to mention a couple of the unemployment insurance bills that passed. Obviously, there was a bill that paid off what we believe is the entirety of the loan that we owe. It's very likely that we'll have to continue borrowing because there's still very large amounts of folks who are making claims, and the amount that we're putting into the trust fund is relatively small for many reasons. I'll get into that here in just a minute. But in addition to that, Senate Bill 7 was passed, and it was a very good bill. It was really important. Folks may remember that in around November, December, the governor mentioned that there was an issue with payments that were made to PUA claimants who were not actually eligible for it, even though they were told they were eligible. They were told they were eligible because initially that's what the CARES Act said. And then after we had started making claims for folks, the Department of Labor changed their mind and said, no, you're not allowed to give these folks this money because of the particular circumstances that they claimed. And so those were called overpayments, and we were telling them that they were going to have to return that money. It turns out that there's an option for waiving overpayments, but it required legislation. And so Senator Givens introduced that bill along with some other measures around preventing fraud, which has also been a real and significant problem, not only in Kentucky, but across the country, and certain reporting to the General Assembly from the state administration on UI performance. So ideally, the Secretary of Labor will start sending out notices to folks who have received overpayments, inviting them to request a waiver, which they will need to do within 30 days of receiving that notice. So for folks, I see some legal aid friends on here and others, I would just make sure claimants who may think that they owe are keeping an eye out in the mail for those letters, because that's going to be a really important thing to respond to, so they don't have to pay back potentially thousands of dollars in benefits. And then House Bill 413 was a bill filed by Representative Weber. It did freeze several increases in unemployment contributions by employers. One is by increasing the schedule by which employers have to pay it. It would have increased their share of unemployment, well, what they pay toward unemployment insurance by about $100 per employee per month. The second was freezing a surcharge to pay for the interest on the loan. And then the third was freezing the increase in the taxable wage base. So employers only pay on a certain percentage on the first $10,800 that their employees make. And that was set to go up by $300, because basically took it back down. This would have done it for 2 years, which is quite a long time in unemployment insurance world. It would have slowed down the amount of money that we were going to be able to put into the trust fund by about $400 million by one estimate. The governor vetoed part of that, really just the second year. So he allowed the freeze the first year to stay in place, and the second year he vetoed it. And the legislature chose not to override that veto. So right now the freeze stands at 1 year. There were many other unemployment insurance bills filed, some good, some bad. I would point folks toward House Bill 406, which was by McKinsey Cantrell. It's a really great overhaul. We put a write-up together on it if folks are interested in that. And I think it really represented where Kentucky needs to go in order to have a robust unemployment insurance program that's adequately funded and meets the needs of a 21st century workforce, which at the moment we have an unemployment insurance program that meets the needs of a workforce from around 1970. Which is why it's not working for folks. And so I would really, encourage folks to pursue that type of legislation and not things that are going to be penalizing to workers, which there's already some conversation about. I will just say that we should all expect unemployment insurance reform to be a common theme during the interim, and during the next General Assembly. And there's already talk about continuing to have hearings about that over the summer. So I will look at the chat and answer any questions I have, but for now, I think I should probably go ahead and turn it over to Adrienne Bush.
Hi, everyone. It's good to be with you this afternoon. Next slide. Okay, so around rental assistance and evictions, I just want to remind folks that there is an order in place through the CDC that began in 2020. It is, I believe I've heard it called an imperfect tool with lots of flaws, but it is a first layer of protection for people who maybe have had issues with their unemployment claims or have had loss of income due to COVID. The other piece of this is now that there is an executive order from the governor that it aligns with the CDC's order that keeps folks covered theoretically between now and June 30th, so that we can start to get rental assistance out and make people whole again. To claim these protections, Kentucky Equal Justice Center has created a very helpful app at homerenterdeclaration.org. But as always, in order to make sure everyone's getting the full protections of the law, we encourage folks to connect with their regional legal aid office with specific concerns. Next slide. So during the whole pandemic, we have paid particular attention to Louisville and Jefferson County, given that so many folks rent in our urban areas. Although we have renters all over Kentucky, and the eviction crisis could loom for all of Kentucky, rural and urban. But over time, we have been looking at calls to local United Ways, in particular Metro United Way. You can see that over a quarter of calls continue to be for housing and shelter, and that of those calls, almost 70% remain for rent assistance. Next slide. I also pulled from the same website, 211 Counts, a percentage, the map of where these calls are coming from in Jefferson County, which will probably be of no surprise to anyone. We know that women-headed households have been hit hard with reduced wages, as Dustin said. We know that Black women have been particularly hit hard, prior to the pandemic with evictions, and during the pandemic, obviously that has continued. If we look at where people live, the types of jobs they are, and structural patterns of race and segregation, none of this should be a surprise to anyone. The other interesting piece of this is that it can look at requests by time and housing and shelter requests in the last year and the prior year. The green line is the last year, and the orange line is the prior year. You can see that housing and shelter requests continued to spike throughout 2020. Next slide. Okay, so do you need rental assistance? We want to make sure that we are getting this word out to folks. We have one portal in Louisville, stopmyeviction.org. Right now is my understanding that all appointments are booked up, so just put a pin in that for now. In Lexington, it is at lexingtonky.gov. How do I get help? And then for the rest of the state, it is at I'm sorry, I can't see because of the chat. Yeah, Team KY HHERF, Team Kentucky HERF.ky.gov. Next slide. So there is a substantial amount of rental assistance flowing in Kentucky right now. That is because of the COVID relief package that was passed at the end of December. So that's the money that's currently being used. It can cover up to, up to between 12 and 18 months of both arrears and rental arrears and rent going forward. It also can cover when folks are behind on their utilities. So we encourage everyone to go to the state's website to check for eligibility income-wise and for program parameters. But as Kara said, the American Rescue Plan Act was passed in March, and that means that additional housing relief is coming to Kentucky. We anticipate that this emergency rental assistance program for people who have been impacted during COVID-19 will continue. And also the federal government, Congress, those who voted for the American Rescue Plan Act recognize that some homeowners are starting to be affected. And so Kentucky will be receiving at least $50 million. That is the minimum that every state will receive to help people with mortgages who have experienced economic hardship during COVID-19. In the meantime, while this program, since the money isn't actually here yet, so the fund still has to be set up, anybody who's behind on their mortgage, we encourage to visit the Kentucky Homeownership Protection Center that's housed at Kentucky Housing Corporation. And then as far as homeless assistance, we have a significant amount of money, in total 52.5 million coming to Kentucky in the form of emergency housing choice vouchers, other types of tenant-based rental assistance, and then grants to expand shelter and permanent housing infrastructure so that we, coming out of this pandemic, can finally have a good response system where when people are in crisis, we are not panicking and sending them to other counties and trying to figure out who is doing what. So we have a real opportunity that I'm very excited about here in Kentucky to really transform the landscape of housing for Kentuckians for generations to come. Next slide. Okay. The last piece I have is we continue to collect stories from folks who have been impacted, by COVID-19, before COVID-19, after COVID-19, on housing and healthcare. And so our staff person, Katie Mueller, is working with folks and talking to them, and will soon be fully immunized and able to travel the state. And so if you have anyone who wants to share their story, we encourage you to share this link with them. Next slide. All right, Jessica Klein.
Thanks, Adrienne. Hi, I'm Jessica Klein with KY Policy. I'll be talking about the Supplemental Nutrition Assistance Program and Pandemic EBT. So with the Supplemental Nutrition Assistance Program, or SNAP, also known as food stamps, you can see here the dip towards the end and moving back up is the pandemic. So we currently have over 143,000 Kentuckians that have joined SNAP since last February. So that's a full year's picture right there. And at the bottom of the slide, when you get these slides, is the link to apply for the program and the hotline if you have questions about SNAP or anything that I say today. Next slide. So one major update with SNAP is this month, recertification begins. This was waived from the past 6 months, so people will start seeing notices coming to them about their recertification date. You can complete the required interview over the phone, which is new, and documentation can also be submitted. It doesn't have to be in person. It could be mailed, faxed, or online through Connect. And stimulus payments, some UI payments, and child care tax credits do not disqualify you from SNAP. So even if you think you have some new income and might not be eligible, you still might. So it's worth calling just to see. And a few federal updates that I want to emphasize again around SNAP is that the 15% increase in SNAP maximum benefits will continue through June. And also the emergency SNAP benefits. We just heard about the April. April has been approved and those should start going out April 10th. So that's a delay from usual. Usually we find out the month before that we've been approved for the next month for max benefits. So this month it's a little bit delayed, and the reason for that is we have another update that we've received additional money towards emergency SNAP benefits. So families with lower incomes who have not received max SNAP before should see an increase there as well. And then that should happen in the end of April also. Also, public charge has ended, which is the federal rule around public assistance programs impacting immigration status. So that is no longer impacting immigration statuses. Also, low-income college students can now qualify for SNAP. There are some new federal rules around SNAP eligibility in college students. So again, with these flexibilities, just because you've been denied before, it doesn't mean you're not eligible now. So it's a good time to call and ask questions about SNAP. Next slide. Pandemic EBT. So we are currently in the third round of P-EBT, and this makes up for school meals missed between October 2020 and May 2021. There's over 600,000 kids eligible through the National School Lunch Program. It's also called free and reduced lunch. So if your child participated in that or was eligible October through May, they might receive P-EBT. Benefits are loaded onto existing P-EBT cards, which is the white card you see here. But if you receive SNAP, the benefits will automatically be uploaded to your SNAP EBT card. So the amounts are going to depend on your school and the amount of days you had virtually for your school. So October through February for fully virtual students that were 100% home during that time, they'll receive $136.40 per month. And hybrid students, which means they went to school some and were virtual some, will receive $81.84 per month. And so those payments have started going out. They've been going out since March, so you may have seen those. The March and May, or March through May, amounts will vary depending on your school district, but it'll stick to that $6.82 per day per child. So that'll be a different payment amount, and that'll be through June. You'll see those payments come out. So the dates here is what the month that they're making up for those missed meals. Next slide. So the new reconsideration process. This is something new that P-EBT has not done before. It's called a reconsideration process. Basically, if your child received less grocery money than you think they should have, you can call the DCBS number here and see if you're eligible for reconsideration, which means DCBS could take a look back, actually verify, the number of school days missed, and change benefit amounts to the amount that students actually should receive. So that should have begun yesterday. There's a new process for this since it is part of this new process for this program. And what you'll need to do that is the student's full name, their date of birth, and their state student ID number, also called SSID. If you don't have that number, you can call your school district office, or if you're in a private school, you can call your school office directly to get that number. And I also put in these important P-EBT contacts if you're having trouble getting answers to some of your frequently asked questions. You can call each of these numbers. The first is for replacing your card or checking your balance if you think you've received a P-EBT on your existing card. And so you'll call the card company to get answers about that. To update your address, or if you want to contest or decline benefits, you'll call DCBS hotline directly. And for foster and kinship care, you'll also call DCBS. So those numbers are here. We also have an FAQ that the cabinet has made in both English and in Spanish that you can find on their website at that link right there. And then finally, we created some social media content, a few handouts, example communications for advocates to share with families or with schools that they work with. You can find those on Feeding Kentucky's website. So that's that link for that. And I think if there aren't any questions, nope, I'll send it over to Priscilla. Thanks.
Thanks, Jessica. Hi, I'm Priscilla Easterling. I'm the Outreach Coordinator for Kentucky Voices for Health, and I'll be covering the marketplace subsidies and Medicaid updates. So this map is an incredible map. This table shows the relationship between uninsured people and the number of COVID cases and deaths in Kentucky. So Families USA, a national partner, they analyzed COVID data from the last year, and estimated the impact of health coverage gap on COVID cases and deaths on a county by county basis nationwide. Truly incredible. So what that really showed us was that 30% of the COVID-19 cases in Kentucky are linked to a gap in health coverage. So that's a ton of people, that's too many, and even though that was way too many people, it still shows that we're doing a lot better than our neighbors. If you look at Virginia, Indiana, Missouri, all of those states are well above 40%, and Tennessee is almost at 50%. So we're doing a lot better than our neighbors. And what we can really say is that this is directly attributed to the extension of presumptive eligibility. We're the only people, and Kentucky is the only state in this area that extended that presumptive eligibility opportunity, and opening that up for Kentuckians helped close that health coverage gap and literally saved lives. Because as we all know, the health of all of us is determined by the health of each of us, because we're all more vulnerable when the people in our lives and our community are uninsured. So next slide, please. The good news is that nationwide, the uninsured rate is kind of decreasing, and Medicaid enrollment is increasing nationwide. So that, especially in expansion states that fully expanded to that 138% of the federal poverty line, Medicaid enrollment is increasing, which is great news. That means more people are being covered. That'll help lower that health coverage gap, and more people will be taken care of. Next slide, please. So this slide is actually, I'm going to go over a couple of the Medicaid provisions that are part of the American Rescue Plan. This one is about the extension of postpartum coverage period. So the CBO actually estimates that about 45% of birthing people covered by Medicaid on the basis of pregnancy become uninsured after the end of that 60-day postpartum period. And about 123,000 of the nation's estimated 440,000 women uninsured during that first year of postpartum would likely be newly eligible for Medicaid or CHIP if that pregnancy-related coverage were extended to 12 months. So under the American Rescue Plan provision, they added this option for states to be able to choose to extend that postpartum period from right now at 60 days to that full 12 months postpartum. And that they made it easier by states only have to file a state plan amendment, which is basically a way for states to update their agreements with the federal government for the Medicaid programs. So in this case, that means updating the Medicaid program to include a 12-month postpartum Medicaid coverage period, which again would save lives. Next slide, please. So one of the other provisions is it allowed Medicaid to cover COVID-19 vaccines and treatments fully. And under the American Rescue Plan Act, it also allows an option for states to cover without cost sharing for individuals, for enrollees, nothing out of pocket to, it allows states to cover all of their enrollees fully. Wow, hold on. Okay, allowed all of their states to fully, I apologize for that. Allow states to fully cover all of their enrollees at 100% for the full year after the public health emergency ends. So that'll help take care of all of those long haulers that we've all heard about and cover their symptoms without any cost out of pocket. Next slide, please. Okay, and this is the general overview of the Medicaid ARPA provisions. So again, it's that funding incentives for non-expansion states. Thankfully, Kentucky did that years ago, they're way above taking care of everyone, doing the best they can. So, thank you, Stephanie. The state option to extend Medicaid coverage and no-cost treatment, vaccine treatment, and Medicaid CHIP beneficiaries, and increased rate for home and community-based services. Next slide. So a couple of healthcare health coverage reminders. So the public health state of emergency right now has not been extended, but everyone, all of our national partners expect it to be extended through the end of the year. It just hasn't quite happened yet. So we're all saying anticipated. We expect that little asterisk, it just hasn't happened yet. So for Medicaid, right now, all copays for Kentuckians are suspended. No one for Medicaid is paying, no one enrolled in Medicaid are paying any copays. And as Sheila mentioned earlier, SB 55 would make that part of the law so that no Kentuckians, period, enrolled in Medicaid would have to pay copays again. Because as we've seen during the pandemic, it is so essential to have easy access to coverage, and something as simple as $1, $2 copay, it adds up and it can be preventative and really hurt people who need to go see a doctor, who need to get some health coverage. So that hopefully that should go into effect in July. CHFS needs to update the regulation. DMS will send a letter to their providers, and MCOs are going to share that information directly with their members. HB 53, which was also a great bill that Sheila mentioned. It adds additional seats for the behavioral health and consumer tax technical assistance committees. There's also a new tax for reentry communities starting. So if you're interested, definitely reach out, and you can see the links for the consumer tax and the MAC pages below. And right now, again, everyone should get their vaccine. There are no out-of-pocket costs associated with it. No one, if you're insured, uninsured, you can still get your vaccine with nothing out of pocket. If anyone asks you for money, please let us know, because they're not supposed to, and we will take care of it. There's also a link to the vaccine appointment checklist. So make sure before you get your vaccine, you know what you need to take, what documents you need to have with you. It's just proof of residency. And if you are insured, they can ask for your insurance card. If you're not, you still won't pay anything out of pocket. So no worries about that. Next slide, please. Okay, so right now, if you haven't heard, there's a special enrollment period open for healthcare.gov. That was just extended about a week ago to August 15th. So that it began in February 15th, and it'll go all the way through August. So this is really a great opportunity for anyone who is uninsured to please go check out healthcare.gov, because part of the American Rescue Plan added a ton of incentives, a ton of additional funding to make health insurance as accessible and affordable as humanly possible at this moment through this provision, because there's still a lot of work we can do. So during this special enrollment period, all you have to do is go through and submit an application. You'll have about 30 days after that to choose a plan. There's a shopping tool so that you can estimate so that you can see what you're eligible for, the tax credit that you're eligible for, the plans that are available in your area, and double check and shop around to see what's really going to work for you and your family. Current enrollees are also able to change during this SCP to any available plan in their area, and you can even switch metal tiers. So say you enrolled back in January, you chose a bronze plan because it was the cheapest option. Highly recommend that you go back now, update your application, because you should be able to get even a silver plan or a gold plan that would have lower out-of-pocket costs, lower deductible, at still a very cheap, affordable rate. You don't need any sort of documents to provide that you're eligible for the special enrollment period. Anyone can just go on healthcare.gov and check it out. And the department estimates that 4 out of 5 enrollees can find a plan for $10 or less after premium tax credits. So really affordable opportunity to get covered and make sure that you're taking care of your family and your loved ones. So all you have to do, any new consumers, all you have to do is go to healthcare.gov or find a connector who can help you. And you'll submit an application. It's just your basic information. They'll do an eligibility determination right then and tell you the amount of tax credits that you're eligible for. And then you can shop around and see what's going to work for you. And if you are already enrolled in a if you're already currently enrolled in a marketplace plan, I highly, 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 highly suggest that you go back and update your application, because you're likely eligible for increased subsidies, and that'll lower your monthly premium even more. Next slide, please. Okay, so the American Rescue Plan coincides with that special enrollment period, and most of those health provisions went into effect on healthcare.gov on April 1st. There are a couple that are still outstanding, but the really important one are those increased ACA subsidies for marketplace plans, when they are lowering that out-of-pocket cost and that monthly premium in as much as possible. So it's definitely worth going back and checking it out. Right now, some of the other provisions that are in there, it removes that upper 400% of the federal poverty line for APTC eligibility. So before, you were only eligible for tax credits if your income was between 100 and 400%. But what they did was they removed that upper limit and instead just said, at whatever income, you're not going to pay more than 8.5% of your yearly income on your health insurance premium. And they calculate the tax subsidy based on that. So that makes it a lot more affordable, a lot more accessible, and a lot more likely that older Kentuckians, as well as those with higher incomes, will be able to find something affordable on the marketplace. For example, people with income below 150% federal poverty line right now, because of these increased subsidies, are going to qualify for a $0 premium benchmark plan. And that is a silver plan with the lowest cost sharing, the lowest deductible, and a $0 monthly premium. That's free, y'all. Like, that's free. So definitely worth checking out. Approximately 122,000 Kentuckians right now are eligible for these new or enhanced subsidies. So if you're enrolled, check it out. If you're not, check it out. That's the bottom line. So, and then beginning in July 2021, there's going to be this great new opportunity for anyone who received even 1 week of unemployment benefits during 2021 to access that silver benchmark plan, again, with a $0 monthly premium, with maximum cost sharing reductions, and regardless of any later income increase. So if you got unemployment for a week back in January, it's definitely worth checking out the marketplace, because beginning in July, you can get a $0 monthly premium with a great plan. It'll cover with like the lowest cost sharing reductions possible. So definitely check it out. And if you need help, contact a local connector. Next slide, please. Okay, so there are current changes to regular Medicaid. So all Medicaid enrollees, again, if you don't select an MCO right now, if you don't select an MCO during the application part of Medicaid, you'll automatically be enrolled in United Healthcare. That's going to be happening for this entire year. Kentuckians under age 65 with household incomes at or below 138% federal poverty line, you're always encouraged to apply for regular Medicaid. Always check it out. If you don't apply for regular Medicaid, definitely check out healthcare.gov. If you don't check out healthcare.gov, check out regular Medicaid. That is the bottom line of my entire section today. So temporary changes to PE right now. So as I've mentioned in our previous webinars, since January 1st, PE is being managed by UHC. So Kentuckians who were auto-enrolled in January, that PE period ended March 31st, at which point they were auto-enrolled for their second PE period, and that will end June 30th. So if you are in that PE period, definitely check out, make sure to fill out that Medicaid application before the end of your PE period, or check out healthcare.gov. Next slide, please. So, and just a reminder, if you have that excess income, which is above that 138%, you will not be accepted. So then go check out healthcare.gov. or if you're over 65 years old, again, you're not eligible for PE. And PE is currently still allowing 2 PE periods within the calendar year. You can access the application at that link. Yep. Next slide, please. Prior authorization, it has been extended through the current guidance for prior authorization has been extended through May 31st. There aren't any big changes. So again, the really big things underneath that are that there should be no prior authorization required for substance use disorder, behavioral health services, or any medications associated with those. Next slide, please. And finally, the ACA lawsuit. As it was argued back in November, and we are still in a waiting period. We are still just waiting to see what's going to happen. Yeah, it's still incredibly important. We're still very optimistic because Biden is very supportive of the ACA, obviously, and so is Congress. So we're just waiting to see what the Supreme Court comes with. Next slide. And a reminder, it can always be fixed by Congress. All they have to do is just change the mandate to a single dollar and the problem's solved. The case doesn't matter. So make sure to contact your legislators, tell them to fix it. So if there are no questions, I'm going to pass it off to Marcy.
Hello, Marcy Timmerman with Mental Health America of Kentucky. Next slide, please. Just a quick reminder that we do have twin pandemics of COVID and racial injustice combined with national political unrest, or probably division might be a better word, presenting significant mental health challenges to all of us that cannot be avoided or denied, right? We're all living this, whether we want to or not. We will be affected, some more than others. We need to acknowledge the toll that these tumultuous times are taking on both mental and physical health. Depression, anxiety, alcohol, and substance use disorder, sadly even suicide, are expected to increase in 2021 and 2022 as a result of all of these events. You can help others and yourself. Next slide, please. Some of the self-care things that we'd like to talk about: look for opportunities to laugh, get enough sleep, and also rest that brain in between sleep periods. Exercise is appropriate. Set healthy boundaries. If you need information on what boundaries are and how to set them, I've got it. So just email me. I'll drop my email in the chat. Be kind to yourself. Turn off that negative voice as much as you can that might be in your brain. Recognize it for being what it is and turn it off, right? It's never right. Stay connected to your loved ones and friends, however you might be able to do that, whether you're vaccinated or not. Connection is really important. Next slide, please. Some other ways to help others, check out our mental health screenings. MHAscreening.org offers clinically valid, free, anonymous online screening for depression, substance use. There's one for parents who are worried about their kids. There's pretty much everything you can think of. And if there's one missing, let me know. Take a mental health first aid course. Mental health first aid is available virtually for adult and youth modules. The youth module is for adults who work with youth ages 12 to 18. The adult one is, of course, adults dealing with adults. It is an online course right now. I'm only teaching virtually. It requires a couple of hours online of self-taught stuff, and then you come and do a Zoom with us for about a whole day. It's about 6 hours. And it's a long Zoom, but it has lots of breaks and it's really fun. You can also take a question, persuade, refer course, which is a lot shorter. It's less than an hour typically. Those are offered free of charge with the state. I forgot to drop the link. I will go find that for the calendar of QPR sessions across the state. Also, just wear green for Mental Health Month on May 7th. Hashtag it MHAKY, and we will be able to see it and share it. That is just a great way to combat stigma. Tell everyone that you know mental health is important to you. That's a really big statewide event, free of charge, right? As long as you have something green. It can be a little pin. Check out our Mental Health Month Tools to Thrive tips. There are tips right now on processing big changes, accepting reality, even though we don't like it, things like that, that are really good for folks that have mental illness, but also for the rest of us, right, in our own mental wellness. You can sign up to receive mental health posters for your lobby or public space. That's a great way to just make it clear that you all support mental wellness and hope that people will get better. And you can also join us for our Mental Health Month webinars and events. There's quite a few things happening toward the end of April and through all of May. Also know the crisis lines. Next slide, please. These are the crisis lines. Take out your phone, put in that 1-800-273-TALK. It's 8255 are the numbers for TALK. make sure you get the crisis line as well. The crisis text line 741-741. You can text any word. Hello is their word. You can text MHA. You can just type help. You can also go to our website for the Get Help section and get the local crisis lines for all over Kentucky, as well as non-emergency crisis lines, the warm lines that are available. And then Trevor Project has multiple ways to reach out if you're LGBTQ or the person that you're calling about is LGBTQ. Next slide, please. And hopefully by the end of 2022, we're supposed to have 988 in place, which is basically the 911 for mental health crisis services. What it will do is consolidate all of those things, hopefully, right? We'll probably still have Trevor Project, but we're hoping to consolidate all of those projects into one place that people call to get help. The state has received several grants recently from the federal government for the initial setup process, which is really encouraging. There's actually a commission meeting on just a couple weeks to start the process of implementation and talking about the good, the bad, and what we need to know. Local crisis line employees will receive the calls whenever possible. And I think that's important because Kentuckians want to talk to Kentuckians, right? If you're from Western Kentucky, you want to know what's available where you are. Right now, we actually have increased the amount of calls to the National Lifeline, that talk number, from 50% to nearly 90% locally answered in 2020. So that is continuing to grow, and I imagine it'll be close to 100%, especially once we get 988 in place. You can call a crisis line for information on how to help someone else. And people don't know that. So I make sure that that's a point that we teach actually in our mental health first aid, that people are like, what? Like, yes, if you're dealing with a situation with someone, you have no idea how to help, the crisis line folks can often help you, especially those local numbers. Federal government regulations require or suggested, depending on who you talk to, that we have the Public Service Commission attach a fee to phone lines that we already pay for 911. So it'd be a similar way that we pay for 988. And we're going to have legislation to do that, it looks like. So be looking for that to come up in 2022 legislative session. Stay tuned. Next slide, please. A quick thing, I think we already talked a little bit about some of this. HB 40 by Deanna Frazier did become law. So we have, I'm sorry, HB 140, I think I said 40. It does expand telehealth to all the different ways we can offer it, removes barriers which existed before the pandemic, really solidified things that we thought were important to do and that everyone really wanted after telehealth became really popular. No-show rates, as Sheila mentioned earlier, are lower than ever. People in rural communities are saying they have better access to mental health services. They don't have to commute an hour or 2 hours in some cases to get care, right? They are able to just call from a car or another private space. They're really loving to do that. Substance use disorder treatment has been able to keep some people employed, I'm hearing, because they're not having to leave for physical groups. They can do the group, in a separate space and take less time off. It's really working well for a lot of folks. So not everyone, but a lot of folks. So for the ones it does help, we want to make sure it stays. And that did become a law. It's a big win. House Bill 53 was talked about a little bit by Priscilla. The Reentry Technical Advisory Committee for Medicaid is brand new. It will help streamline the healthcare access process for those reentering society from jail or prison. Why would we care about that under behavioral health? Well, the majority of folks in our jails and prisons have either a mental health illness or a substance use issue or both. So this is really important for us. I'm glad that we have a seat at that table as well. If I missed anything on that, let me know, Sheila and Priscilla. Next slide, please. And we don't have any updates really on the SUD waiver for treatment. We're waiting on CMS. So you all can see the old stuff. Next slide. And now it's Emily.
All right, thanks, Marcy. I won't go over all of these slides, but why don't we advance to the next one, Kelly? Thanks. Just wanted to let you know that we are putting together a new explainer. If you've seen some of our explainers in the past, they're usually a front and back, and we try to really distill complicated information, policy information down to the essentials, what you need to know, what people in Kentucky, healthcare consumers and others need to know. And so we have created an explainer about the American Rescue Plan and how it helps Kentuckians. We focused on 6 ways that really directly impact Kentuckians, because we know there's this whole mess kind of happening with state and local funding and how it's being distributed and used, but people have access to some of this relief right now. Of course, the stimulus checks are part of that. There's some other relief I'm going to just really quickly touch on, but that's all going to be on this front and back explainer. And then we'll have a companion FAQ that goes into more detail for you. But what you can see, what you can expect to see on our explainer is basically covering what it is, who does it help, how do you get it, with hyperlinks to the right places. And so what we need to know, and I think that both Kara and Dustin touched on this, is people need to file their taxes in order to get a lot of these benefits, even if they don't typically file them. And there are some resources for that, some assistance that we're trying to point people to, and it would be fantastic to have your help. Let's go to the next slide. And then the subsidies and special enrollment period that Priscilla just ran through. We want to make sure people know that there are new options for them. If they've shopped before and been discouraged, they need to shop again. And if they have a plan, perhaps a plan that's off the marketplace, we often call them junk plans because they're not as comprehensive, they don't have all the protections. They should really look at the marketplace again. Even some people with employer health insurance, if they're paying more than 9.83% of their income, they should look at healthcare.gov to see if they are eligible now for subsidies. So lots of people have this option, and people with unemployment insurance can get free plans. So just as a reminder, this information is going to be benefiting hundreds of thousands of Kentuckians. So getting out as far and wide as possible is really key. And then SNAP food assistance, Jessica ran through all of this. We want to make sure people know that it's available, that it's expanded, and where they can go to apply or reapply. Same with P-EBT. We know that it's automatic for a lot of people, but not for everyone. And some people don't realize that those cards are in the mail coming to them. So we want to make sure people are aware of this and know where to go if they need help applying, or if they have lost a card, need to change some information, etc. So the last is housing relief. Adrian went over this as well. But this is information that is a game changer for so many Kentuckians, and we really want to make sure that people know where the assistance is and how to get it. So if we go to the next slide, you'll just see more resources here for rental assistance and homeless assistance. Let's go to the next slide. We've been including these resources in every slide deck, but they're places we want to make sure you have the link that at hand, easy to get to. These are all things that continue to be good resources for folks. Let's go to the next slide. Legal aid. I know Adrian brought up legal aid in terms of housing. It can also be really important in terms of benefits like Medicaid and SNAP, but we want people to know who they can call to get legal assistance. And then food assistance resources. This is something else we include in every slide deck just so you have an easy resource to go to. And these trackers are trackers that Dustin and others at KY Policy have been keeping up on a monthly basis with data, with resources, research, and analysis that are really great go-tos if you want to know a little bit more about the policy and the numbers behind these programs. Let's go to the next slide. And then Adrian brought up our story banking project. We have joint funding for collecting experiences of people who have had Medicaid or other healthcare issues, whether good or bad. It's the same with housing. And we want to make sure that policymakers and the public understand what barriers people face in terms of healthcare and housing, how health is absolutely, or I should say, housing is absolutely essential to health, and that we provide these new perspectives to people, because when you hear someone's story, it can often change your mind about how programs work and what kind of safety net programs we need in Kentucky and who they're there to serve. So Katie Mueller is our story banker. She's fantastic. She'd love to talk to you. And then be sure to save the date for our upcoming webinars. We have our usual state and federal policy updates on the dates that you see listed here. We don't have the state and federal update in May. In May, we're going to have our Thrive Kentucky Forum with the Cabinet for Health and Family Leadership, Health and Family Services Leadership, I should say. And that will be an opportunity to hear from the cabinet what they're doing with the American Rescue Plan funding, other changes they're making to programs, any updates they want to share with us. If you have certain questions for us, or if there are topics that you want us to ask them to cover, put that in the chat box now, or you can put that information in the evaluation. We always send out an evaluation link after these webinars. Let us know what you want to be covered, and we'll try to get that on the agenda. Already from the chat today, I made sure that we were going to cover childcare for the forum. So your input is really important. And then the Advocacy 101 training, that's evergreen. It will always help you. Go back and watch it again. I always learn something new. Okay. We can go on. And then if you are a licensed social worker or a certified community health worker, if you need a CEU, contact Kelly. And I think our final slide is a thank you again to our sponsors, Aetna, Humana, and United Healthcare. We really appreciate their support. It's helping us keep these webinars going. So thanks everyone, and we will be sending out a follow-up. All right, have a good day, everyone.
Great job, all.